All we've been asked to do is to sit on our bottoms on the sofa and watch telly for 6 weeks, and we shouldn't complain too much.
You must stay at home.
Whatever it takes.
We will beat the coronavirus, and we will beat it together.
Hello there. Ministers must today assess the UK's lockdown measures. However, we do know that it's going to be on Sunday night when the Prime Minister Boris Johnson outlines what will be a clear roadmap, we hope, for phase 2. Dr Hilary Jones is here. It's interesting comparing us to other major, I guess, badly hit European countries, Hilary. Italy, their lockdown lasted under 2 months. It began on the 9th of March and people began going back to work on the 4th of May. France went into lockdown on March the 17th and is planning to begin lifting measures on the 11th of May if data remains encouraging. And Spain went into lockdown on March the 14th and also began lifting measures on the 4th of May. Do you think those countries have followed the right strategy?
Yeah, I think almost all countries have had some form of lockdown and social distancing, which is absolutely right. We have been in lockdown for 6 weeks. Wuhan, remember, was 11 weeks. But, I think we've just got to be careful. We've got to keep the case numbers down, mortality rates down, help the Nhs Cope. And if it means being patient a little bit longer, then I think that would be wise. But I think we should have gone into lockdown a little earlier, not had those mass gatherings, Cheltenham Festival, etc. And we would have done a bit better. We have a 64 million population living on a small island. We have the same population as France, roughly, but half the land. So we're densely packed together. We haven't closed our borders. 18 million people have flown into this country since January with no checks. Only 273 were quarantined. So we went into lockdown quite late. We've got the advantage of being able to see what happens in other countries when they come out of lockdown. But lockdown is there to keep people safe and to help the Nhs cope. That's the bottom line. And I think it's however long it takes, within reason. Hopefully, we'll be hearing shortly that we can ease lockdown a little bit by taking certain measures. But we can compare ourselves to other countries. Other countries compare their mortality figures differently. Italy, for example, they collate them regionally. We won't know what their real death figures are for some time, and probably the same in other countries. So we can compare ourselves to other countries, but it doesn't mean that much.
And I don't believe the Chinese figures, for example, for one moment.
Exactly.
But look, it's VE Day, Hilary, or at least the 75th anniversary of VE Day. So I guess I am keeping in mind the great sacrifices that my grandparents and many other parents or relatives put in order to keep us safe all of those years ago. And it feels like that's quite a good moment, isn't it, to say, you know what, we can do this, we can keep this up. World War II lasted 6 years, we've only been going 6 weeks.
They had rationing, they had a different enemy, they lost children and people of all age groups. It went on and on and on. I think, all we've been asked to do is to sit on our bottoms on the sofa and watch telly for 6 weeks, and we shouldn't complain too much. This is the worst pandemic that we've seen in 100 years. We will get through it, but we have to be strong, we have to be resilient, we have to be patient. And, despite what we think of some scientists, most of them do know what they're talking about, and we will get through this.
Exactly, we can do it. We can do it. Well, look, the first question today, Hilary, has come from Brian Chappell, and he has said this.
Hi, Dr Hilary. Now the National Health Service have been treating and learning about the virus for some time now. Do those of us that catch the virus have a better chance of survival? Stay safe, Brian from Havant.
Yes, they do. We have a better capacity to cope in hospitals. We have more equipment. We have more PPE. We have more ventilators. We have a better understanding of what this virus does to the human body. So we're learning all the time. We've got vaccines being worked on. We've got different medicines being trialled. So yes, people now have a better chance than was true even as back as January, which wasn't very far in medical history, really, is it? 4 months. We've learnt a lot. Still a lot to learn, but we're getting there.
Jill asks, if my friend and I have both had the virus, could we meet each other because I couldn't give it to her and she couldn't give it to me?
Well, have they both had tests? Do they know for sure that they've had COVID-19, or are they guessing? If they're guessing, no, they can't meet up. Even if they have had the tests, then we still need to be socially distancing, whatever our history. So even if they're both feeling better, they can go to work. But households shouldn't be getting together socially at the moment. Hopefully, we'll be easing lockdown shortly, and they'll be able to get together and compare notes. But right now, nobody should be making any excuses and saying, "Well, what if? What if?" No exceptions, not even chief scientific officers. And if we adhere to that, we'll get through this much more easily with less mortality.
Although I do wonder if Neil Ferguson's exploits are making people think in a different way, Hilary, because this is a very interesting question from Dennis, and I'm fascinated to know your response. He says, my partner and I both have our own houses. We are healthy 70-year-olds with no symptoms whatsoever. We have self-isolated separately in our homes for 6 weeks. Are we now allowed to live together? The loneliness is so difficult. And Hilary, I have been personally campaigning this week for the government to look at a way to reunite lovers, boyfriends, girlfriends, partners who are on their own, because I think they have been a forgotten demographic. Not everyone does live together if you're in a relationship.
Sure. The mental health issue mustn't be ignored. It's important. And when people feel desperately lonely, that has to be taken into consideration. What I would say is this, that if you're going to live with somebody permanently, if you're going to make a move permanently to live with somebody close to you, then that's acceptable. But what we need to discourage is people going back and forth, taking more journeys, touching new things, touching their face, passing the virus on, whether they're symptomatic or not, to other people. So don't move households on a regular basis. If you want to go and live with somebody under the same roof, then fine, but you've got to stay there and live as a couple.
Got it. All right, well, amazing advice, and what a great week of questions we have had. Keep them coming in. You can use the hashtag Ask Dr Hilary on any social media platform, or you can visit thesun.co.uk/Dr Hilary or talkradio.co.uk. Hilary, thank you for another great week.
Thank you, Dan.
We are, I know, remembering everyone on VE Day, of course, and I hope we have a restful weekend.
Thank you, Andrew. Yeah, they're my heroes. VE Day, very important. I shall be out there saluting them, and I'll see you again next week, Dan.
Thank you, Hilary. See you Monday.
Bye now.